Hey doctors, have you ever found yourself bogged down by the often tedious, time-consuming pre-certification process for medications like Entresto? Today, we're going to navigate through the step-by-step process for obtaining pre-certification with Aetna Medicare, making sure that you get your patients the treatment they need without the hassle. Let's make this easier and more efficient together. Hello doctors, welcome. We know how critical time is in your practice, and that any disruption can take away from your focus on providing the best patient care. One of these pain points is the pre-certification process, especially for higher-cost medications like Entresto under Aetna Medicare. That's why today, I want to guide you through this process step by step, so you can confidently get those approvals without any unnecessary back and forth. First, let's understand why Entresto requires pre-certification with Aetna Medicare. Entresto is a valuable medication for treating specific types of heart failure, and as you know, it plays a significant role in enhancing the quality of life for many of your patients. However, due to its high cost and the need to ensure its appropriate usage, Aetna Medicare requires pre-certification before they provide coverage. It's not just about bureaucracy, it's about confirming that Entresto is both necessary and safe for each patient, making sure that the treatment aligns with their individual needs. Now let's break down the pre-certification process step by step, so you're fully equipped to help your patients. The first step involves discussing with the patient and their healthcare provider to confirm that Entresto is indeed the best choice. Once you're sure, the healthcare provider will begin the pre-certification process on the patient's behalf. This collaboration sets the foundation for a successful application. The next step is filling out the pre-certification form specific to Aetna Medicare. The form will require key details: the patient's medical history, their diagnosis, and the justification for prescribing Entresto. It's important to make sure all the information is filled in accurately, without missing any details. Incomplete submissions will just lead to delays. The good news is, Aetna has these forms readily available on their website, and submissions can be done electronically, which makes the process smoother for you. Once submitted, Aetna Medicare will review the request. During this stage, they evaluate whether the criteria for coverage are met. They might reach out for more information or clarification, and staying responsive here can significantly speed up the decision. Being proactive during this stage reduces holdups, helping your patients receive their medication faster. After the review, you'll receive Aetna's decision, and hopefully it's an approval. Your patient can then pick up Entresto from their preferred pharmacy. But if the pre-certification is denied, don't worry. Aetna provides a reason for denial and the necessary steps for appeal. Working closely with the patient, you can often provide extra information to make the case stronger during the appeal. Let's not overlook the significance of coding. ICD and CPT codes are an essential piece of this puzzle. The ICD code represents the specific diagnosis, and the CPT code describes the treatment or service provided. These codes help Aetna understand why Entresto is being prescribed, providing a clear rationale for medical necessity. Accurate coding is critical here. It ensures there are no misunderstandings, so we avoid any unwarranted denials. Let's touch on some common concerns. The pre-certification process can take up to 14 days, but if your patient's condition is urgent, don't hesitate to request an expedited review. It can make a big difference. If a denial does happen, appealing it with strong evidence and additional documentation is always an option. And remember, even with pre-certification approval, it's crucial to check if there are any copays or other out-of-pocket costs under the patient's plan. Navigating the pre-certification process doesn't need to be a frustrating experience. It's all about being proactive, staying in close communication with the patient, the healthcare provider, and Aetna Medicare. With proper preparation, you can make sure your patients have access to the best care options with minimal disruptions. But we understand, the process can be tedious and take away from your precious time, and that's where we come in. At Staffingly Inc., we offer professional outsourcing solutions to handle tasks like insurance verification and pre-certifications for you. With Staffingly's help, you can keep your focus on what matters most, your patient's health. We've got your back with our 24/7 support, cost-effective solutions, and a dedicated team that takes care of the paperwork. For tailored support, reach out to us at 800-489-5877 or drop us an email at support@staffingly.com. We're here to make these administrative headaches a thing of the past, so you can keep doing what you do best: saving lives.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.